Right, hi guys, CES 2026. Obviously, we found another robot company. So this is Ambyon, and we got Yop.
Yes.
Is that right?
That's right.
Yop.
Yeah.
Okay, got that right. My pronunciation. Who's going to give us an overview? We're on the Netherlands booth, so we got a whole area dedicated to the Netherlands, and as you know, mainly robots for me. So we're just going to have a chat through. So first, give us an overview about the company, and then we can go into the product, if that's okay.
Sure. So as a company, we focus on the healthcare market, mainly big hospitals. We see that there's a huge shortage in nurses and also other healthcare employees. And we see that nurses spend a lot of time on walking to get stuff, medication, and all other small goods in the hospital. We even see they spend like 33% of their time, and they are kind of highly educated, right? So, and they need to spend their time on patient care.
Yeah.
And they focus it a lot on these type of tasks.
That's fun.
What we try to do as a company is have a robotic solution that tries to alleviate them in some of these tasks. So we focus on the logistical tasks that it does, that transport. We see that there is a big adoption threshold of hospitals in using these type of technologies. So we see a huge pressure on the whole healthcare system. Too little nurses. It's really a bad situation, and it gets even worse due to the aging in the future.
Yeah.
But on the other side, there are all these robot companies, and we see the occasional pilot with a robot, but no real adoption.
Right.
So what we focus on is having a robot that has a technology that's based on human cognition principles. So it can really see with its 3D cameras the world as humans also do.
Right, okay. Interesting.
And it maps then the whole world with all this information and really sees the semantics, the meaning of the world.
Right.
And also uses this information to work better with people. So to anticipate where they're going so it's not driving in the way, to really know where it needs to deliver it, and really intuitive interfaces that people can use.
Right.
So technology is really about having robust technology that's based on human cognition principles that can thrive in this dynamic, complex environment.
That's right.
And we leverage that technology to really do a lot of testing and to really be adaptable to people, so it gets used by the hospitals.
You see.
So we're really focusing, the main core of our business is to focus on reducing adoption threshold.
Right.
So this robot we can put it in a hospital, and it can just drive. It can see which features have information it needs to use. It can see that automatically.
Right.
It can even use existing elevators in hospitals like people do. Exactly.
Okay. Right, okay.
And this is really, many people say, why not use a direct connection with the elevator? That's way easier. They're right that it's easier technology-wise, but in terms of the market, the business, to change all the elevators costs a lot of money.
Yeah.
You have many elevators, they have different manufacturers,
Yeah.
and it's such a hassle to do that.
Yeah.
So they don't use this, and then the pressure keeps there. So we really focus on that thing, adoption, make it as easy as possible that this robot works. They just put it there, it adapts to people, it can use existing elevators, and we hope that this can bridge the gap between the technology and the people.
Okay, no, that sounds interesting. So from a navigation point of view, so if I bring this into the hospital, do I have to do a map to start with or something like that? Or?
Yeah, so it can do it automatically.
Okay.
So it can see the features in a certain with its cameras. It uses
so that's this one here,
the 3D camera,
and then the camera down there, is that not involved?
Yeah, it's involved.
Yeah.
The reason we have a camera there also is because it has kind of a blind spot in the front. Ideally, we would have two eyes like people do, but cameras are not as far as people's eyes. People's eyes are really
you got that bigger vision.
Big vision. And of course we can
we can get that instant movie. Yeah.
So maybe in the future we are exploring different cameras which have like huge field of view, but they are limited in the market.
Yeah, there's a certain view, as you said. The camera's there and it's got a view of like that, but it hasn't got a massive view. Yeah.
No, it does not. This is like 90 degrees, I think, in the height, and like 120 or something in the width. That's so that's not a mold.
Okay.
So it uses, but it does have 3D information, right? It has two eyes, so it can do triangulation, and then it knows from each pixel it can estimate the depth. So it has this point cloud in color. Then we use all these AI algorithms to really see all the things, see people, see the floor, the walls, the whole structure of the environment.
Okay.
And it can use that to see, okay, which things are distinctive enough, and it saves that.
Right.
And then when later it's there, it recognizes these features again and it knows, okay, I am at this position.
Right.
And it doesn't need to know exactly, because like people, we also don't need to know exactly, because when we're walking in a hallway, when we're knowing that if we know we go in the right direction, that's fine.
Yeah.
Right? Only when we have a decision point, we might need to go to the left or right, but then use these other features again.
That's right.
So we see the state of the art of robotics. It usually tries to follow this precise line.
Yeah, that's right. Yeah.
And when something changes, because it needs perfect localization for that, and that's really hard when all things change.
Yeah. Yeah.
So we have this whole different philosophy about that.
Right.
So, and that's based on kind of how people also do that.
Yeah, I mean, I think it's the future, as you said. Like, you've got the AGVs which follow the lines. You've got AMRs which you have to map.
Yeah.
I suppose this is a new generation where you have the cameras that will just constantly.
We're still thinking about a new term, a new word for this.
Yeah.
So
Yeah.
maybe if the community has any ideas.
Yeah. Yeah. It's
It's not a cobot. We are thinking in the direction of, because it's intuitive, works better with people, and something in that direction.
Yeah, as you said, it's one step closer to sort of human vision and human senses. Yeah.
It's really a colleague, a personal assistant, maybe that direction. Because when we say, of course, many people see a robot, and it is a robot, but robots are
very broad.
very broad. Yeah. So
Okay, I mean, so is this a prototype at the moment, or have you deployed any into hospitals yet?
Yeah, so we have a few customers in the Netherlands for now only, but we are looking to expand because we want a solution that's worldwide available.
Right.
We have a few customers in the Netherlands, but it's kind of in the pilot phase.
Of course.
Because this is another finished product. It's a prototype.
Yeah.
So it is active there, but when you really want to sell it to multiple customers, then you need to have all the certifications ready, and that's not yet for this robot.
Right.
But it is for our next one that launches in November.
And what's the styling? Is that a logo there, or is that like who's done the styling?
We get this question from many people, and it's kind of a funny story.
Yeah.
So we want to have a robot, a carrying robot, right? And we thought at some point we had this kind of design. A design is always nice when it fits well with the environment, but it has one unique feature. Right?
Yeah.
It kind of stands out, but it's not too annoying.
Yeah. I agree.
So we had this design, and it wasn't built yet, and it had these arms that like it was hugging, like it was carrying.
Yeah.
You know, can I carry robot?
Yeah. Makes sense.
Yeah.
Makes sense. As you said, it's quite distinctive. That's the first thing that I saw. So it definitely was work. Yeah.
It also made me good that everybody asked the question. You know, you have the whole story.
Yeah, definitely.
But eventually, so we got a partnership with Alphatrol Medical. That is a company in the Netherlands that have these medication boxes.
Right. Okay.
And their technology is about that you can different drawers can be locked separately. So it's not that a nurse can confuse different medication with different patients, because it scans at RFID badge and only the dedicated drawer opens, right? So they really have a solution for that. And we actually have the box inside.
Right, okay.
But it's a big box.
Right, okay, so
I can turn it around maybe?
Yeah. Just have a quick look. We've got it.
Trying to use the joystick for now.
Yeah, I do. Just like that, thank you.
So this is the.
I see, yeah.
So this is the box.
So you got the big boxes and the small boxes.
Yeah, I'll stand here for.
It is.
And it can scan the badge, and then a certain drawer opens. But it was a bigger box than we expected. So
yeah.
when we had a round design,
Wow.
And then the robot was huge.
Yeah.
The robot, yeah.
Yeah.
So eventually the hug
Yeah.
got kind of
you tucked it in the
squeezed into a two.
Yeah, yeah. Yeah,
So
get the
that's
size in
kind
there.
of story about it.
No, that's all.
So, yeah.
No, I think that's good. I think that's quite a good overview. So we've got about 10 minutes there, which is perfect. Okay, no, so that's a good overview, Job. So very much appreciate your time. And yeah, guys, if you have any questions, I'll put all the details down the bottom so you can reach out to the guys. So thank you very much, Job.
Yeah.
Thank you.
Great.
Welcome.
Now, please follow us. We have a LinkedIn and a website. Yeah. If you search Ambyon, you will sure find it.
Ambyon. Perfect. Okay, thanks, sir. Thank you.
Great.
Bye-bye.
Great.